Although we have a lot of treatments that work very well for hepatitis C, the decision to treat still needs to be very individualized. And that's because important patient factors and virus factors come into play when we think about what regimens we want to use. There are 6 genotypes of hepatitis C, almost like different strains of hepatitis C, and different drugs are used depending on the genotype that a patient has. There are also patient factors, so the level of liver disease that's present, whether patients have had a prior history of treatment using the interferon-based therapy, and then other comorbidities that a patient might have, for example, HIV co-infection or renal disease, chronic kidney disease. These are all factors that influence what drugs are available to be used in a patient and then also dictate the treatment duration for an individual. Hepatitis C genotype 1 is the most common genotype that we see in the United States. Almost over 75% of patients with chronic hepatitis C infection have genotype 1. It used to be one of the hardest genotypes to treat because it did not respond as well to the interferon-based therapies, and we've seen a reverse in that where it's now much more successfully treated with the direct-acting antivirals. There are several regimens that are available to treat genotype 1, and those typically include 2 or 3 drugs. Some are taken once a day, some are taken twice a day. Differences in terms of which regimen are preferred really sometimes are determined by drug-drug interactions that a patient might have between those drugs and the other medications that they take. And then in terms of treatment duration, most commonly patients will be treated for about 12 weeks. But patients who have cirrhosis or who've had a history of prior treatment failure to other regimens may require up to 24 weeks of treatment. In some rare cases, we're able to get away with treating some patients with genotype 1 with only 8 weeks of treatment and have had good success, but that's not the norm.